Everyone. Welcome or welcome back. My name is Himani and I'm from India. I'm on a wellness and weight loss journey using Mounjaro, a GLP-1 medication approved for diabetes and also approved for weight loss. I'm using it for weight loss. Today, we have a very special guest, Dr. Amit from Oviva Health. And Doctor, why don't you introduce yourself and tell us a little bit about what you do and what specialty of, doctor you are, and then we can take it from there.
Thanks, Imani. Thank you so much for giving me this opportunity to be part of your channel. So, yes, my name is Amit Srivastava. I'm a general physician practicing in the UK. I'm working with Aviva Health. I'm one of the co-founders to try to bring health to India. I run my own clinic in the UK near London. We have our own weight management clinic here that we have been doing for at least 2 years, which is going really well. So I want to answer any of your questions, share my experiences here, and do what we can to help you guys.
Yes. So, like I informed you guys that I'm partnering with Oviva and for my wellness journey. And now I thought it would be a great idea to get a doctor here, like an expert here, because it's all science backed and expert led doctor led medication and doctor led weight loss program. So why not get an expert and ask the basic questions that you guys keep asking me. So doctor, let's just start with the question. I
Yeah.
before I wanted to know what is that one thing that leads to weight loss? That is the major, like one of the most frequently asked questions that, what is the root cause of obesity or weight gain?
Weight gain is a very it's there's so many factors that play into weight gain. There's environment, what you eat, how much exercise you do, genetics, hormones, especially in women, postmenopausal women, so many factors. There's not just one thing. I don't want the one thing I want to make clear is it's not just though about how much you eat or how much exercise. Some people still struggle to lose weight, even trying their very best in all of those aspects. So don't get disheartened if you can't do that. And that's why we're here to help you, to guide you in whatever way we can. And looking at the reasons. And so naturally as we grow older as well, our metabolism slows down. So what I could lose maybe 10 years ago, I can't I can't lose now. And 10 years later, I won't be able to. So the science has a big part to play of it. There's lots of studies done around the world in US, UK that shows genetics, hormones are all have big parts to play in all of this.
Right. And what are some of the most common medical reasons that people, are not able to lose weight or they gain weight, are more receptive to gaining weight?
So there's lots of conditions. I think the most common one, quite quite prevalent in India and around the world, is thyroid problems. People with underactive thyroids, the thyroid will tend to put on weight. Um, there's another one called polycystic ovarian disease or syndrome, so PCOS. So that's another one, mainly affecting the younger people, and sometimes that can even affect fertility. And that's why the mainstay of that treatment is weight loss. Um, there's numerous conditions that can cause, but those are the two commonest that people will
Yes. So
will
I
talk
got
about.
diagnosed. I got diagnosed with PCOS. We call it PCOS
Really?
or PCOD in India. We don't call
Yes.
it PCOS. So
Yeah.
here, like it was undiagnosed because my cycles were regular and I
Yeah.
never had an issue. But I was obviously gaining weight and it was unexplained. So
Yeah.
when I went to the doctor and we did an ultrasound. That is how I came to know. And I'm 30, almost 35, and I came to know last year that
Oh, okay.
I have
No, no, no.
PCOS. So yes, I understand, and doctor was in fact so empathetic towards me that, you gain weight because of PCOS and PCOS also causes weight gain. It's such a vicious cycle. So yeah, I understand. Like it's so common for especially women, 1 in 4 in India are, hit with
So,
PCOS.
so these things are a lot more commoner than we think. And
Right.
you did a really good example where hormones play a big part in weight gain rather than anything else. You can try your diet, your exercises, but it still might not be enough. And that's where science can help with weight loss. Yeah.
Right. Yeah. So how do you like how did this happen that, obesity was started being treated as a medical condition and not about eating less or eating more and doing more? Because that is what we've heard all our life that, eat less, calories in, calories out, and that is all that there is. And it's not a medical condition. It's mostly treated like a taboo here. Obesity
It
is
is.
not treated as a disease. So how
Yeah.
is it a disease? Like what is the clinical
So,
explanation?
so obesity is a disease. It's a worldwide recognized disease. Um, it's really important we identify it. It's an actual chronic problem, actually. It shouldn't be a taboo. Some people honestly can't help it. Okay. And actually, especially now we're in an era where we are looking after our health more. We want to lose weight. And more importantly, there's treatments for this now. So
Yeah.
we should look at it from that point of view. I think the most important, like the message I always I'd send out to my patients is weight loss is so important for so many reasons because it can really lower your cardiovascular risk. Cardiovascular risk, I mean things to do with your heart. Your blood pressure goes down, your cholesterol goes down. Cholesterol is this substance, it is something that can clog up the tubes in your heart, and that's what causes heart attacks, or the tubes in your neck or your brain causing strokes. These are all things no one wants to do, wants to have, sorry. So your sugars will go down. It's really important for diabetics, okay? That you start losing weight and all these things go down. You reduce your chances of developing various cancers, breast cancer for women, colorectal cancer for men. There's actually a list of 13 cancers, which we can maybe talk about some other time. You reduce your things. So obesity is linked to so many. It's also it's a condition in itself, but it's actually related to so many other conditions. And if you can tackle obesity, you'll tackle all those other things. It's a cascade effect. You treat
Mhm.
that and you reduce your risk for all those other things.
And how
So
does metabolism play a role in all of this? Because I've heard that, we might be doing, like two people might be doing the same kind of things and same kind of eating the same kind of food, but their
yeah,
metabolism, it
yeah.
might be different. How does that play a role in obesity? And how does, these weight loss programs that we will be talking about help
Uh,
with that?
so Himani, we all have that one friend who can eat as much as they like, don't do any exercise, sit on the couch all day, and they don't put any weight on and they're so thin. And it's so frustrating for all of us who
Right.
try to lose weight. We've got that.
Right.
And that's the really good example of metabolism. Their metabolism, their pace of how they burn energy is faster. So their metabolism is faster. They burn energy. They don't put on the weight. At the same time, people listening to this who might be thin, who might even fall into that category, it's still really important you look after your health, you get your cholesterol checked, because although you're not putting fat on, the cholesterol is going somewhere. So
Yes.
so really important whether you're thin, and this isn't just about weight. It's about the health. Promoting health is the main thing.
Right. We keep
Yes.
saying that, being thin or lean does not mean healthy. Like you have to
No,
be healthy from within. And in India, body image is such, not just India, I think all over, the body image is such an issue that
yeah,
people tend to neglect that, there are four types of PCOS. I did not know that, there is
yeah.
a thing called lean PCOS and where you don't gain
That's
weight.
right.
Yeah, you're
Yes.
lean, but you can still have the hormonal imbalance and you need help for that. Like there are
Yes.
treatments for it. So people definitely like they should stop blaming themselves, and even if they are thin, they should be focusing on their health and hormonal health and internal health.
Always, I always recommend regular health checks, blood tests, just to make, to just you, so you know where you are. Always have a baseline, and yeah.
Right. So
But
related to this, doctor, like how should someone like when is it that someone should stop blaming themselves and look for help? Basically, people don't know where to start. Like, how
Yeah.
can one seek medical help? What are some of the markers or health conditions that they can approach a doctor for weight loss? Like,
Okay.
what to keep in mind, how to approach this?
So we a lot of us talk about BMI, okay, in terms of weight loss. Now that can be categorized into no underweight, normal, overweight, obese. So generally, a BMI of over 30, or in South Asian population, you can take a mark of 2.5 off that, means that you're overweight. We tend to work out, there's lots of calculators out there on Google. So for any listeners who want to find out their BMI, if they want to know if they're overweight, lots of BMI, so BMI calculators on Google, that you just input your height and your weight, and it'll calculate and it will tell you if you're obese. Okay. I think that's a really good marker, as a good start. I think most of us also know if we're unhealthy. Most people look at their waist size. So waist is really important. If you're carrying a lot of waist around your tummy, I mean, a lot of fat around your tummy, that's the bad fat. That is the bad fat. That's what we call, I mean, it's a good indicator of what we call visceral fat. Visceral fat is the fat in your organs, in your liver, around your heart, around your kidneys, all over your body. So the bigger your tummy is, the more fat you have around all these vital organs that you need to live. And as you slowly reduce your waistline, it will help with all those other, reduce the fat within those organs we've just mentioned.
Right.
Yeah, but so just
Right.
going, sorry, I diverted a little bit, but going back to your question, I think a good start is that, number one, identifying the problem. We are all becoming more health conscious, but we all know actually if we're overweight, for example, and if we know that, a good thing would be to start have a blood test, or speak to a doctor, speak to one of us, even at Aviva Health, we can guide you. Um, yeah,
Yeah, so my experience with Aviva's team was very smooth. And that is why I thought, let's definitely do these interviews because people here need to stop blaming that, there's a difference between weight loss and fat loss as well.
yeah,
And like you said, visceral fat is something that I also learned recently that is the bad fat and that is the fat we need to lose. And, healthy fat is something we need to have. So all
yeah,
of this information is so vital. I'm so
yes,
glad we are having this conversation, Dr. Amit.
no,
And so apart from BMI, like if somebody is like, what I want to ask is like, for example, there's a girl who is working out every day, is managing her PCOS. She is, it's in control, everything is there, but she's not able to lose the weight. And it's been like 6 months, 8 months, and she's getting frustrated. So that is one of the markers, right? Like you need help. You
you
need
need
to see a
help.
doctor. Right.
Yeah. So,
Okay.
so the, so absolutely. And I think the first thing to do, it's hard because we're all very busy people. We're all rushing around, especially in India. It's everywhere actually. It's so busy. But you, the key thing is with looking after your health, it has to be sustainable. Lots of people go on crash diets. We'll start new. It's the new year now. We'll go to the gym, sign up to the gym, and go for 1 or 2 months. But actually, I always say to my patients, do something you can sustain long term. Okay. If you know you can't go to the gym every day, go every third day, as long as it's a long-term plan that you can embed into your diary. And just as you mentioned about this lady with PCOS, and there's lots of treatments now also available, um, non-medical as well as medical advice, lots of things out there that is there to support her, to help her lose weight and have all the other health benefits associated with it.
Right. Yeah, definitely. I'll have a separate PCOS episode because that's a very common,
Yes.
health issue here that women face. Apart, let's get into the GLP-1 medication. I want
Yes.
to know the basic because my audience is also, wanting to start, but they are, not aware, either not aware or there's not much information for them to, make a informed decision. So,
Yeah.
to start off, what are these GLP-1 medications and how do they actually work in the body?
So GLP-1 medications actually have been around for 30 years. So I want to number one say that out that it's not a new medication, okay? It's been tried, it's been tested for years. These new medications, whether it's Wegovy or Mounjaro, they've been here for around a decade or so, but they've just been formulated into a once a week injection. Before this, there were daily injections, there were other things as well. So the key thing is I don't want people to think it's a new medicine. It's not been tested. What it will be the long term. It's tried and tested and has been around for decades. So GLP-1 medications, they work by GLP is a natural hormone within the body. It just promotes more of that hormone, and that works on the stomach to make you feel fuller. Okay, so that the effect of you feeling fuller because it slows down the pace at which the stomach empties. Your stomach doesn't empty so quickly, so you feel fuller for longer. Okay. The other thing is with these new medications is that this constant cravings you have, it's in the brain, the hormone, the center in the brain that gives you these cravings. It also slows that down as well. So all this constant snacking and eating crisps and it sometimes somewhat goes out the window when you start eating this. So that's how it works. It has a mechanism by which it helps with insulin as well. Um, hence why it's very good for diabetics. It really lowers their sugars in the long term.
Right. And
But
I
in
think the
essence,
GLP-1 community, we call this, not having cravings, the food noise in the brain. We call
food
it food
noise,
noise.
exactly.
Yeah.
Yeah,
I
yeah,
didn't know what it was before I started using the
yeah,
medication. So
yeah,
we call it food noise that, it's completely mute. We can
absolutely.
actually, it's such a game changer that we can actually focus on things beyond food. That my
Yeah,
whole day is not revolving and, focused around
yeah,
food. I can make, be more productive, think of,
yeah.
I started this channel, like that was such an amazing thing. And
It is.
got in touch with you all. Like it's so amazing that, your brain can do so much more rather than just focusing on
Yeah.
food and, turning to food for
Good.
anything and like slightest of inconvenience.
No, and my disclaimer is also that not only do I prescribe Mounjaro, as in GLP-1s, I'm also on it. So
Oh,
whatever effects I've had, I know exactly what you mean, the effects, how amazing it is, how the food noise switches off, how your portion sizes go down.
oh, we
It's
would
it's
definitely
been
love to know more about your journey, doctor. Like this is
yes,
so interesting for a doctor to be on this medication. You have
yeah,
first-hand information. So, like not
absolutely.
just the medical, but as a user as well. So,
Yeah.
could you please
I've got a
share
blog
some of?
actually. I've got a
Okay,
blog on my website, on the web or Beaver website, so anyone interested can
I'll link it to the description for sure. But just
go.
to give our audience a little bit sneak peek into what your journey was like. When do you
Yeah.
started and how much have you lost? That is what people want to know.
Yeah, so I started at around a hundred 104 kilos I was, and I'm 5'10", 5'11", maybe if I want to show off. But realistically, my BMI was too high. I was overweight. So I naturally lost weight. I lost around 10 kilos by dieting, exercise, but then I plateaued. That's the problem. If you had asked me 10 years ago, I would have still continued to lose weight. And this is another good example of metabolism, that my metabolism has slowed down. I'm in my 40s now, but beforehand, I would have definitely been able to carry on losing weight, but I plateaued. So then I decided to actually try this GLP-1 because I was prescribing it. I was seeing the good effects. Thankfully, I've not had a patient who's had a bad experience. And it's one of those wonderful things because everyone ends up quite happy being on it. So I started that, but in my mind, I also want this to be a permanent change, a sustainable change. So I did incorporate. It's not just, this is not a cheat. You have to work at it. It's not just, okay, I'll jab myself once a week, carry on with my lifestyle. Because as and when you want to come off it or go down to a maintenance dose, you need to be maintaining that weight with your lifestyle. So for me, it meant changing shopping habits, what I buy, what's not in the house you won't eat is one of the things. I know it's a lot easier in India. You can just tap and people will bring stuff to the house in
Yeah.
10 minutes. But realistically, what you don't buy, you don't eat. Set up a really good structure in terms of um kind of like I have protein bars for kind of snacks or protein shakes even for like not my main meal but a meal for example. Getting to those habits and they can be quite nice, quite tasty. We at Aviva Health we've also partnered with one of our um a company that supplies protein bars, protein shakes, lots of things actually
Yes,
to
I tried the millet bars. They were really tasty.
oh okay.
And like I always say this to people who are getting in touch with me that, please make changes that are long term and sustainable. And for any non-medical advice, I can always help them. But, you need to have a good doctor to help you lose the weight. And because it's not a 1 month or a 2 month
Yeah.
process, once you go on these medications, it's a long term,
Long
project.
term.
I would say it's a project. And then you can't just, shotgun it and leave it
You
cold
can't.
turkey, as you say.
You
We
can't.
have to like tether off it and, wean down
Absolutely.
in a proper
But
structured way as per your
yeah,
doctor's advice.
yeah.
And
And I
yeah,
the other key thing just to add is exercise. Exercise. So my big part of my journey is at least doing 3 or 4 or 5 kilometer runs or on a treadmill at least in a week. Um, and that way I've now weaned off. I've been on it for a year, weaning off and maintaining, and
so nice.
and maintaining the lifestyle as well. So that's the key.
Yeah. And how
Yeah.
much did you lose in the last 1 year?
Well, I was 93 kilos. Yeah, 93 kilos when I started, and I'm down to, sorry, 71 kilos.
Oh, that's
So,
nice.
so I've
And
lost
your highest weight was 104 kilos.
104, yes.
Nice. So
So,
20-25 kgs, rather
yeah.
more. Nice.
But the key one thing, another tip this comes coming to my head, but the key thing is to spread it out. The key thing is slow and steady weight loss. Try not to. It's not a competition. There's going to be lots of people on GLP-1s. Some
Right.
will lose weight faster than others. Others will there is a problem. Not as in if you lose weight too quickly, that can be a problem as well.
Right.
The way to
Right.
look at it is most of us have been overweight for years. So actually, don't try to lose it in months. Give it, give it,
Right.
give it time. Do it with efforts,
Right.
and you'll be rewarded, and you'll have fewer side effects. That's the key.
And what about this is the biggest, not just a myth, but a misconception that it's only for diabetic patients. How
Yeah.
true is that?
So initially, it was licensed. Eli Lilly or the makers of
Yeah.
Wegovy also did, did the tests and the thing for diabetics. It works wonders for diabetics. And let me be clear, type 2 diabetics, type 1 diabetics should not be on this. Okay. So type 2 diabetes are the patients who've developed diabetes later on in life. Okay. So for them it works wonders. Because you stop the cravings, it helps with insulin stabilization and things like that. So I've had lots of patients who were diabetic who are not diabetic. Along the journey, they realized it causes weight loss. Okay. Hence, it's now legally licensed for weight loss as well. So people are using it for weight loss. So yeah, that's a complete myth. There's more people around the world now using for weight loss than they are for diabetes.
Yeah. In India, we just have it for, I think, weight loss because like people are who are diabetic, it's obviously a game changer for them, but it's completely approved for weight loss in India.
Yeah. Yeah,
Yeah.
it is. Yes, it is completely licensed for weight loss in India. Yeah.
And Doctor, recently Ozempic got launched in India.
Yeah,
So I have heard there is a difference between semaglutide and tirzepatide.
yeah.
Wegovy in Ozempic are semaglutide, and Mounjaro is the tirzepatide. What
There's,
is the
there's a-
difference, and how? Because doctors are now prescribing either or not, and because it's a different medication, but they are giving a choice to the patient in India. So
yeah.
how do they function differently, and how can someone who's going to a doctor, and if they are given a choice, what to keep in mind to make a choice?
Okay, so Wegovy is been around for a bit longer. Otherwise, Wegovy, otherwise known as Ozempic. Okay, so we most probably have all heard of Ozempic. That's just been around for a bit longer. It's very good, and it's a very good drug, and it's helped a lot of people. In essence, all I would say Mounjaro is a a newer drug. Okay, it's kind of the newer model.
Okay,
Um, it's a dual action Mounjaro. So it's got two actions. It's got two hormones. It's not only a GLP-1 agonist. I won't get too technical, but it's something called GIP. It's got another thing that helps with weight loss. So, if I was to simplify things, I would say Mounjaro is a newer drug, most likely to have fewer side effects than Wegovy, and it's a dual action. It works in with two mechanisms compared to Wegovy.
got
Um,
it. Like it's a
so
better, newer drug, and it has better composition in terms of medical. Uh,
I would say so. As you would expect with any new drug,
right,
you would
right, right.
you
So why are doctors giving an option, like for example, a patient maybe because they have lesser weight to lose, or they are not diabetic? Like how does it work?
It shouldn't really be a thing. So I would say in the West, Manjaro is definitely more popular, and effect people seem more effective. I think if you were to do the comparisons, what I can do is send you a comparison because between Wegovy and Manjaro, you can lose, as in studies have shown that you can lose more weight with Wegovy with fewer side effects. But what I'll find is a table that compares the two that maybe you can share with your viewers.
Right, definitely.
But it's in essence, it's also about pricing as well. I think the pricing of Wegovy is especially in India it's comparable because I think the prices are roughly the same. Is that right with Wegovy?
It's a little bit higher, but then the dosages are not that vast like how we have for Mounjaro. And
Yeah,
initially, because Mounjaro was launched first, it had the first mover advantage
yeah,
that people were prescribed
yeah,
that. But now, since Ozempic is launched, now doctor is giving an option to people,
yeah.
to patients, that you can go for Ozempic, Wegovy, or Mounjaro. Like they
Yeah.
are not making a choice for the patient;
I,
they're asking the patient.
so what I would say is, and it's most probably on the doctor's responsibility to give them their opinion about which drug. Personally, I would say obviously Manjaro being the newer drug, it's most probably the better option. We have doctors if you really want to talk to and discuss it with. We've got doctors who can discuss that at Aviva Health. Um, yeah.
Got it. All right.
So I think when doctors, sorry, it was again when doctors are are giving the patient the option, it's because most probably a little bit of lack of knowledge on their part. It's a new thing, especially even in the UK, I would say that lots of doctors know very little about the difference between Wegovy and Manjaro. So if it is one of those things, you should definitely speak to a specialist rather than your general GP or physician, because it does require that extra special bit of knowledge to know the differences and the side effect profiles and things like that.
Right. Like before I got in touch with Oviva Health, I was directing people to an endocrinologist or an obesity or diabetes
Yes.
specialist,
Yes.
because those are the specialty doctors that can help you, identify it properly and
Yes.
suggest you a proper plan. Because in India also, since it's so new, doctors are also still getting informed and getting the learning. Like they are
Exactly.
equally, like, noob like us patients, it's, except for the fact that they have the medical knowledge. But it's so difficult sometimes that, I had to speak to three doctors before I decided, because they were not very informed. Like, especially in tier two and tier three cities, it's such a problem that people are not informed.
Yeah.
Like, the even the medical fraternity are not informed. And these drugs, it's so sad and unfortunate. These drugs are available over the counter, and the prescriptions are so easy to get, that there is a lot of misinformation happening, and people are not even knowing how to manage the side effects,
So
which is what I want to know next from you.
yeah.
But somebody who goes on this medication, wants to go on this medication, but is scared about the side effects, and especially the long term, like Mounjaro face and loose skin and all of these, side effects, muscle loss.
Yeah.
So, like, what would be your take on this, and how can you soothe
So
those patients?
so that's a big topic. There's several questions there. So let's
Yeah.
break it up a little bit. So the first thing is side effects. Now, if you do it sensibly, okay, um, do you do it probably you introduce the 2.5 milligram, for example, Manjaro or the Wegovy 0.25 milligrams. If you introduce it slowly into your body, it's known as a starter dose. You will have fewer side effects. So the common side effects are things like nausea, constipation, some get diarrhea, heartburn or reflux, or heartburn or indigestion. Those are the common things. So those are very short-lived. I think both of us have been on it, so we know that actually they're not big side effects. And if they do occur, they're easily treatable. To avoid side effects, you just need to have the right advice. The key thing is don't overeat. So if your stomach has told you you're full, you stop eating. None of us like wasting food, but essentially all I'm saying is either put the leftovers in the fridge, eat it the next day. But when your tummy says stop, you stop. Okay? Avoid heavy food, cream, oily foods, because these will exacerbate. And actually, the whole idea is you're trying to lose weight and make adaptations. Not to say you can't treat yourself. One of the key things I will always say to my patients, I still enjoy my food. I might eat less, but I still enjoy food. Okay, it's not that you become this person that goes from food loving to food hating. You still enjoy it, so thing. But what you will find is if you start going up doses too quickly, and that this is the problem when you do it from an inexperienced people will go from 2.5 milligrams to 5 milligrams to 7.5, trying to get as high as they can as quickly as they can. Actually, do it slow and steady is my advice, even if it means being on 2.5 milligrams for 2 months and then 5 milligrams for 2 months and 7 point. I've never had to go above 7.5 milligrams. There's nothing that you need to get to 10 or 12.5 or 15. Everyone is unique and individual. It's your own personal journey. So you do what you can in response to your body. And actually having regular doctor reviews and doing it doctor-led is important because going on to some of the other questions you asked in terms of muscle loss, there's lots of questions about muscle loss, but actually you do it properly. And once again, this is where I say this is not a cheat. Injecting is not a cheat. You need to work at it. So if you don't want the side effects and you want to lose weight, you need to do it properly. You need to do the right exercises. Okay. You need to tone up your body as well. Then you won't lose it. And the same with diet and nutrition. You need to make sure you're eating the right foods, the right proteins. Okay. Um, to make sure you don't have the side effects or the muscle loss. And there's a lot of information, and once again, you can consult your doctor, or certainly consult one of our experts at Aviva Health. As part of our program, what we try to do in our program is give a whole holistic picture with the protein supplementation, with nutrition advice, what's good to eat for all the various diets, whether you're vegetarian, non-vegetarian, vegetarians, anything, we can cater for that. But also more importantly, you get a whole dashboard of exercises that if you follow those, you'll do really well out of it. But yes, in
So yeah, that
essence,
is what when you mentioned not go up doses very quickly.
yeah,
I had this person comment on one of the videos that, "Ma'am, why are you on 7.5 for 8 weeks when it is only for 4 weeks and I have to go up?" He, poor guy, moved to 15 mg within like every 4 weeks. He titrated up, and now he's at the maximum dose. And that is his maintenance dose, according to him. And it is just sad that people are not being informed properly, and
yeah,
they are spending so much money and time and energy on this. And how do we like avoid that? What is it that like there should be a checklist to people? Like I knew it because I researched, and
yeah.
then I came in contact with like a team from your end. But apart from that, like if you don't have a good doctor, that is why I think it's very important to have a good doctor as well.
You know,
And
absolutely.
yeah, and every
I
four
think
weeks, is there a thing called GLP resistance or something that we keep hearing?
no. I'll answer your first question first. So in essence, I would say try to get it done with a specialist is another thing. Someone who knows what they're talking about. Okay, I've been to clinics in India and I've seen people prescribed GLP-1 and the patient hasn't even been weighed. Okay. One of the key things is you track your weight as well. Okay. There's lots of apps out there that can help you do that. But do stuff be start your journey with someone you can you can trust, you can rely on someone who knows what they're talking about, someone who gives you all this advice. Okay. The other thing I would say is, as with anywhere around the world, unfortunately, there's a lot of fake stuff going out there. Okay, so just be a little bit careful where you're getting it. If someone's saying they can do it, it doesn't seem legitimate. Make sure it's from a proper pharmacy. Is the thing because of the clear liquid and the pen is especially the Mounjaro pens are the same pens used for insulin, so it can easily be replicated. Insulin pens are um a lot cheaper. They can get the pens and just put any fluids, change the label. So be careful where you're sourcing it from. Is the
Right,
thing.
right. So we have two disclaimers for the audience. One is to get it from a reputed provider or a pharmacy or doctor. And second is to go for a specialist rather than going to people, private practitioners who are uh, just as new as you may be, and, are not. And always take second opinion. I feel like we take two, three opinions whenever we are injecting
Yeah, yeah,
something to our body, right? So I think it's
yeah.
important to get a second opinion if you are, even a little
In
bit skeptical,
doubt.
because it's your hard-earned money. So
Yeah.
definitely consult a specialist and take the medicine from a reputed or a verified seller.
Stella, and when we come to that, because I think being open and honest is really important, but realistically, this journey is not just you're going to, because I've heard this that oh you only need to be on this for 1 month. You actually realistically you are going to be on it for at least 6 months and most probably longer. So factor that in into your finances and everything, that actually this is not just a 1 month journey or 2 month. Actually,
Right.
you will most probably lose weight, but that won't lead to sustainable weight loss.
Mhm.
So it's important to realize that and factor that in for sure.
Yes. And there's a lot of misinformation, doctor, regarding microdosing that is going on. Is it recommended or does it work? Or are you telling patients that, don't go about it on your own, don't take it on your own?
So I guess the key thing is that what do you mean by microdosing? There's so many variations in definitions, so
Right.
that I'm trying
So
to
what I have heard, I don't know the meaning, but I have heard about split dosing, micro dosing, and short dosing. I don't know the differences as such.
So I think there will be different opinions. There always are, where people will get a higher dose pen and do half the number of clicks or this number of clicks. I recommend that if you're having side effects, if you can't, let's say you can't tolerate the 5 mg per dose, then we can think about reducing the number of clicks, and we can certainly guide anyone who wants to do that. But as for any medicine in this thing, you should always take it as it was licensed by the company, okay? Because studies have been carried out on that amount, okay? On those doses, on those pens. They say that once you've started a pen, opened a pen, it should be finished within 28 days. So there's all these things that, if the manufacturer is saying that, then we need to respect that. Especially, I always say that, especially if something that we're injecting or taking into our body, then, when we're trying to make ourselves healthier.
Right,
Um, so I would say always follow the manufacturer guidelines.
right.
Yeah, for
Especially
sure.
because I think it's not like made in India initially. It is going to be manufactured, or maybe it started. I am not too aware. I think Chipla is partnering and they are
That's right.
manufacturing it in
Yes.
India.
Before we
But
go.
because it's coming anywhere from outside and we have different temperatures here, the storage requirements are particular. It's very important that we don't experiment too much with it and go as per manufacturer
Yeah,
guidelines, because that will at least help ensure the efficacy of the medication. That is
absolutely.
what I believe. And
Yeah.
this is what the doctors that luckily I have been blessed that I got in touch with good doctors initially, and now with your team as well. Like they have made me more informed and better. Like you know, uh, we say that it has confirmed my initial advice as well,
Yeah.
and what was that was given to me. And I'm so happy that I was informed well, and I'm
Yes.
able to help others in the community,
Yeah.
GLP-1 space in India.
Because I know what everyone's thinking. It is an expensive drug, unfortunately.
It is
And hopefully as new drugs come out this year, next year, we'll see the costs go down.
right.
But for the time being, I'll always say follow manufacturers' recommendations. Yeah.
Absolutely. Absolutely. Any message to our viewers who are watching? Because they're always skeptical and asking me that, is it doctor approved? And, titration is something that they always ask, and we've covered that. Any message to our audience, like Indian audience that is watching, about these medications that you would want to maybe caution them against, or like maybe a soothing message, because people are skeptical. So maybe
Yeah.
a message from a
I think
doctor's mouth would be better.
I think once in a lifetime you get a drug that really, really is life-changing. I think this is one of those drugs. I think it's available to the general public, it's available to all of us, but it's a drug that can really help in all aspects of health, heart health, liver health, kidney health. It's not often you get one medicine that can do so much. So I think if you are skeptical and you're still having doubts, then please speak to one of our professionals, expert professionals. I'm more than happy. At one point, what we want to do is a live Q&A session. So where you can just ask me directly instead of this. So we'll organize that soon if that's something the viewers would like.
For sure.
Um, to do that. But my one message is till date, and we've treated a lot of people in the UK now with GLP-1s, and I don't think I've had one negative or bad experience, is what I'm saying. So if you're in that phase, you want to think about it, I would say definitely go for it. At least try it. Yeah.
Right. Thank you so much, Dr. Amit, for spending time with us. And I would definitely love to do more Q&A sessions with you, and live for sure, because that is, we can definitely schedule it beforehand so people are also aware of it. And
Yes.
it was lovely interacting with you.
Yes.
Some of my important doubts were also cleared. And it's so important to have a good doctor, is what I have realized. And today just confirms that.
Yeah.
And thank you so much for being
Well,
here with us.
thank you so much for hosting. It's been really, really kind of you. I'm more than happy to help anyone who'll be interested. Thank you.
Thank you. Okay. So, Dr. Amit, one last question I wanted to ask you is that it's such a taboo here in India that it is considered that, oh, you are fat and you are using a lazy method or a shortcut method by using these medications. I am losing it naturally, or so and so can do it. Okay, eat your, get your dairy in and get your normal हम दाल रोटी खाते हैं इंडिया में, ये बोलते हैं कि दाल
हाँ
रोटी खाओ, लाइक स्पेशली फ्रॉम द नॉर्थ, जैसे कि दूध
हाँ
पियो, दाल रोटी खाओ, नेचुरल फूड खाओ, और देखो तंदुरुस्त
हाँ
रहोगे, यू विल स्टे हेल्दी एंड यू लूज
हाँ
वेट ऑल्सो। एक्सरसाइज करो ना, लेजी क्यों हो? So
हाँ
this is the
हाँ
only thing that they think, that it's a traditional way. That is what I
हाँ
feel. But what would you say to people like that, and how can we break the taboo? As a doctor, what would you say?
Well, I would definitely say it's not just a taboo in India. It's worldwide. We get this in here, America, Australia, everywhere. So it's one of those things. But my message is clear that, it's your health and you only one person will be there to look after it, and that's you. You need to take responsibility for your health. Um, I've mentioned the benefits before in terms of cholesterol, blood pressure, sugar levels, fatty liver going down, reduction in cancers, breast cancer, colorectal cancer, lots of 13 different cancers, lots of things. So we all know the benefits of taking such a drug. It can really make us healthy, and that's down to you. Now, let's say if we reverse the conversation a little bit and say that you don't that you continue to be overweight and you can't shift it naturally through exercise or diet, and you do become diabetic or your blood pressure's high, your cholesterol, you'll end up on cholesterol tablets. You'll end up on diabetic tablets. Some people might be injecting insulin, blood pressure tablets, all these things, which are also unnatural. Okay. So, um, whatever, whatever people say, oh, I'll always say, listen to your inner voice. It's your health, your responsibility, and do the right thing by you. Um, yeah,
Right, right. Yeah. And I think people, like you said, people are taking Botox and other things and other methods to
sure.
improve their skin, and plastic surgeries to improve how they
Yeah,
look. Why not take this medication which actually helps your hormones and at the internal level, and
yeah,
fix your gut and fix your health from within.
yeah. And
So yeah,
as things are changing, especially in India, it's a taboo will always be there. And the thing is, this is your journey. The other thing is, if you really also don't want anyone else to know, you don't have to tell anyone. Things can, like I said, through our service, we're quite privileged that we offer discreet delivery, payments, everything. You just do it on your phone or your computer, and it gets delivered to your door as well. So I do understand the social pressures in India. We have similar stuff here as well. So but you can do things around it, and as time goes on, hopefully these taboos will go down.
yes,
But like
fingers
I said,
crossed. Fingers
fingers
crossed.
crossed. But what I would say is that don't think of this any more different than taking any other medicine. And hopefully, I think my final message is hopefully by taking this medication, it will stop you having to take all those medications in the future, the blood pressure
Right,
tablets, the cholesterol tablets, diabetic meds, all these things we talked about. So think about your future.
right.
Yeah.
Perfect. Thank you so much, Dr. Amit. Thank you.
No worries. Thank you. Thank you.